Hi, I'm Dr. Mark Quigg. I work at the Collingwood General and Marine Hospital, and I'm the physician lead for infection control.
Very good. And of course, here we were talking about the coronavirus and the concern about it, and maybe we could allow you to just explain what it is.
Okay, what the coronavirus is it's a cousin of SARS. Basically, SARS, people may remember back in 2003, SARS, they might remember, less likely to remember MERS, which was another coronavirus, hit the Arabian Peninsula, came from camels back in 2000, maybe 12, something like that. So it's another coronavirus. The official WHO name is COVID-19. How it works is, for many people, particularly young people, it'll come across as a common cold, kind of low-grade fever, often less than influenza. In some ways it's like influenza, in some ways it's not. Influenza is a different kind of virus. The good news is SARS, for people who remember back in 2003, the death rate was on the order of 10%. The death rate of this is much less. The question is how much less. In Wuhan province in China, the death rate was 4%. In other places, the estimates are it's going to be less, probably on the order of maybe 0.7, 1%. The challenge is that, to put that in perspective, influenza has a death rate of 0.1%. So in a nutshell, what we're talking about is an illness that might have a death rate that's basically 7 times, hopefully not 10 times, what a regular influenza season does. And a regular influenza season kills on the order of 3,000 to 5,000 Canadians every year. So multiplying that by 7, especially over a short period, could be obviously catastrophic, both for the individuals affected, but also for potentially overwhelm our healthcare system.
So you see, this is much more dangerous than influenza because its mortality rate?
Yeah, well, it's potentially more dangerous than influenza because so far the mortality rate seems to come in at multiples of influenza, and that's why. And with influenza, we have people have natural immunity because most people have had influenza at some time in their lives. We have vaccines for influenza, and we also have what we call antiviral medications, pills to treat influenza. For coronavirus, we have nothing.
What should people do?
First, people shouldn't panic. For most people, young, healthy people, this will be probably not much worse than a cold. In fact, many people will have it with no symptoms. The key thing to take away is there are certain groups, however, that are very high risk to get quite ill with this. Seniors and folks basically over the age of 55 with major medical problems. Emphysema, diabetes, chronic lung and heart disease, those are the folks who are more at risk, and they really do need to pay attention to this.
What are the key things that we need to remember about it?
The key thing is, the first thing absolutely is meticulous hand hygiene. Wash your hands, wash your hands, wash your hands. As best we can tell at this point, it's what we call droplet spread. It doesn't go through the air like something like measles. So the key thing is that somebody coughs in their hand, then touches a door handle, and that's how you get it. So the key thing is when you're out in public, out in places, is to wash your hands like crazy.
Where can we get more info about it?
Basically, any of the local public health sites, Public Health Ontario, Simcoe County District Public Health Unit has websites. Health Canada has a great website. The WHO, the World Health Organization, has a great website. There's all sorts of really good websites where people can pick up information. And to get back to the issue, number one is wash your hands. But the second thing to introduce for high-risk people is the concept of social distancing. Because these groups are so vulnerable, and the seniors, and especially people with pre-existing medical problems, they're at very high risk. And it's absolutely essential that going forward over the next 4, 6, 8 weeks as the situation develops, that in addition to paying great attention to hand hygiene, that they basically take reasonable measures to limit their potential exposure. And what we mean by that is avoid going to large gatherings. And you've seen just yesterday the NBA canceled their basketball games because putting a whole bunch of people in a stadium close together is going to facilitate spread. So that's the two messages are hand washing, and especially if you're in a vulnerable risk group, to really think, what do I really have to do in terms of going out or going to a public place or whatever. And unless it's something that's really important, maybe you can ask a friend or a relative to go out with you, or to go get your groceries for you or something like that.
So today the schools were basically closed for the next 3 weeks. Are you suggesting that we restrict open services, gatherings, and even church services?
Well, each faith denomination is going to have to sort of make their own decision with respect to that. I think that the reason why, one of the major reasons I'm sure why the province has closed the schools is that epidemiologically, from an infection perspective, children tend to spread infection very easily. And it was found in previous pandemics, like the H1N1 pandemic, that closing the schools slowed the spread. So in fairness, the province is acting proactively to try and slow the spread so that our situation doesn't deteriorate rapidly, like unfortunately happened in Wuhan province in China, and happened in Italy, and happened in Iran. So in terms of, I think each faith community is going to have to decide by the nature of their religious practice and stuff what they wish to do about services. But the point I would ask all pastors, ministers, priests, etc., to get across is particularly to the vulnerable populations, the seniors, the people with pre-existing medical conditions, especially above age 55, but maybe even a few younger patients, transplant patients, what have you, is that under these circumstances that it is acceptable in the faith dynamic that they not attend for a period of time for their own safety.
Now you mentioned that restricting access to people's exposure to that. What can we do to help?
Well, basically in terms of, I think it's absolutely critical that us as a community, and the churches being a big part of that, particularly help vulnerable seniors. If there's a senior next door who has a lot of chronic lung and heart disease and would be high risk to pick up something if they went out, to say, how about I'll go do your grocery shopping for you. And just simple, neighborly activities like that. The nurse, who now the schools are closed, has no child care, stepping up to say, your kids can come over, the stay-at-home mom, your kids can come over with me, you get to the hospital and work and look after patients. Those are the kind of community things that completely honestly the churches have always done, and right now is going to be particularly important that they continue to do.
So if an individual feels like they have some of these symptoms, a cold is coming on, what should they do?
Okay, the most important thing to do is to telephone first. They can call telehealth, the provincial telehealth number, and ask for advice. They can call the Simcoe County District Health Unit and speak to a public health officer and get direction as to where they go, or if they need, whether they can just monitor their symptoms at home. Because the key thing is, obviously we want people safe, but at the same time, we don't want people flooding the ER, for example, and overloading the resources that are there for the sickest patients. At the same time, the hospitals are going to have patients with coronavirus. That may not be the place, if you've got a mild illness, you want to go. Now, obviously, if people develop serious symptoms like shortness of breath or any serious symptoms, then that's a different story. Obviously, they should be calling an ambulance at that point.
Anything else you'd like to communicate?
At the hospital, I'm kind of known as, because I deal with the pandemic issues, etc. My nickname is Dr. Doom, because I deal with these kind of things. But I really want to give across, or get across to people, is hope. We're people of hope, and the thing is that the key thing is, if we all pull together, if we work as a community, if we look after each other, and we do the social distancing, we do the hand washing, etc., we can save a lot of lives, prevent a lot of people from getting sick. We can keep our medical resources from being overwhelmed. And what I'm hoping is we can come through this like the South Koreans have, like Singapore and other places that have done these kind of things and have come through successfully.